Okay, on the pregnancy and talking to women about the severity of kind of the shock that the body goes through when she actually has and goes through
Oh,
pregnancy
it's
to
no
term.
joke. Pregnancy is no joke. I've had two children. I've been pregnant twice. There's definitely risks to being pregnant that you got to be aware of. One is that when you're pregnant, back in the day, basically, when we used to deliver out on a field, like before there were hospitals, and we would just go out in the field, deliver your baby, come back to the farm, um, we didn't want to bleed to death. And so over time with evolution, our bodies, when we're pregnant and delivering, tend to be a little more likely to make blood clots than to bleed. So that is still the case now, even though I had both of my babies in a hospital and not in a field. But what that means is during pregnancy, you're a little more likely to form blood clots than bleed, because back in the day, we didn't want to bleed to death in the field. But what those blood clots can mean is women, when you're pregnant, are at a higher risk of strokes, of a blood clot getting stuck in the artery that goes to the lungs. That's called a pulmonary embolism. And so these are real risks when you're pregnant that I think a lot of people don't talk about.
Right, so that goes back to some women that are experiencing fatalities in
Absolutely,
pregnancy.
yes. We got a maternal mortality rate
We need and
problem in this
we need to
country.
take a deeper dive into that, Doc, to find out, is it medical, is it money, is it myth, what's going on?
I think there's a few things. I think pregnancies can be dangerous. And then I think that there's a superimposed problem of particularly minority women, black and brown women, not being listened to when they report a problem. I know Serena Williams has talked about when she had a pulmonary embolism and she was telling people and people weren't believing her, in that it's a problem both of being a little more likely to clot and have pulmonary embolisms and other medical issues that happen with pregnancy, and some women not being listened to, and women not having access to preventative care.
So we need to, you would say that women need to take a serious inventory every time that they want to engage in childbirth.
Oh, yeah. I mean, think about it. Yeah, if you're thinking about having a pregnancy and a baby, really think about it. Make sure, if at all possible, you've got your health care in order. Medicaid does cover pregnancy and a little bit after pregnancy. In fact, Medicaid covers 2 out of every 5 births in this country. But there are some big Medicaid cuts coming down the line in the most current
Right.
federal budget. So it's things like that to think about. What's your insurance going to be? How's your health going? What kind of resources do you have? It's really worth thinking about anytime you have a pregnancy.
Okay, so now let's look at some of the specifics so that women understand. Hey, these are some of the trauma that your body can experience and may not go back to the way they were prior to. Let me tell you why. Because these women, they need to be informed of the specifics of risk of permanency,
Sure.
change in their body. Because my understanding is that it's the birth of a child is puts different areas of her body at risk, whether it's anywhere in the brain at all. Does anything, any of
Okay.
the blood vein, does
So
anything?
postpartum hemorrhages, postpartum vasculitis it's more rare, but we do see it. A problem with the brain that can happen around the time of delivery. But just in general, childbirth it's traumatic. It can result in some significant tears, which can be repaired. And there are women who do benefit from pelvic physical therapy after delivering a baby. And I think that's something that a lot of people don't know about, but that can really help, especially if there's been a tear, to get those muscles strong again.
Okay, so now let's close out with what we talked about in the prior video, and you kind of touched on it.
Sure.
It's basically the natural process of the completion of the body. Are you suggesting that the reason why a woman's body after menopause begins to stop producing the estrogen is because her body is moving into maybe the second phase of life itself?
So yeah, it's an interesting question. Why does menopause even exist? And there's some theories about this, but basically the main idea is, yeah, the estrogen drops, you start getting those hot flashes. That's one symptom of that decreased estrogen. You stop having your periods, you stop being able to have children, that kind of thing. But hormones can be replaced, and it's something worth talking to your physicians about if it makes sense for you.
Okay, now you as a doctor personally,
Yeah.
when do you get to a point medically where you say, you know what, I don't want to address that. I know that if we did medically address it, it may extend my life another 4 to 6 years, but I'm okay to gearing up and being ready to move on to, basically the finish line for the actual body. So you talked a little bit about, people have to die sometime.
Oh, sure.
So when do you get, when would you be enough for you to say,
That's
hey,
an
I'm
interesting
ready to bring
question.
this thing to a
You know
close?
what? Doctors in general, we tend to put in our wills and stuff, no extraordinary measures. We tend to say that more than the general public because we see what that looks like in the intensive care unit. We tend to say, you know what, my brain's gone, let me go. Don't keep me on a ventilator forever. And I say that, I've told my husband that, because we tend to see what can happen. Sometimes we can prolong life for a very, very long time with minimal increase in quality of life. So it's definitely a conversation worth having with your loved ones now, so that once you're in an ICU and intubated and they're breathing for you, your families and friends don't have to be guessing what your wishes would be.
Okay. Now close us out with where you're at. Close us out with something medical, something political. Talk to these women, advocate to them, tell them what message you want to tell them.
Absolutely. Right now, the current federal budget is going to cut $880 billion from Medicaid. And Medicaid does cover 2 out of every 5 births in this country. Please call your reps. Tell them hands off our Medicaid, because that will result in thousands of unnecessary deaths every year.
That reminds me. I'm so glad you mentioned that. The last topic I want to touch on is your work with medical access to the inmates.
Oh,
Here's the
absolutely.
question, doctor. Now this is a deep dive question.
Sure.
And I've read some of your articles you've written on this. And you are right. The law says that equal access to medical treatment for an inmate
Yeah.
has absolutely nothing to do with what crime they committed to get in prison.
Oh,
We're on the same. We're on the same team there. However, some of the people that are in the control room, doctor, they seem to think, well, if he didn't commit a crime, he shouldn't be in prison.
I used to think that too. So it turns out, in terms of all incarcerations, 60%, more than half, were nonviolent. Okay, so there's that. Drug things, whatever stuff. So really, most, if you, not just prison, jails and all that, all incarcerated people, when you include the immigrant prison as well. So there's that. But beyond that, many of these people, the vast majority of people there are not going to be there for their whole life. They're going to come back into society. So if we have someone come back into society with some brain injury that wasn't treated or some medical problem that wasn't treated, they're going to come back out disabled and end up costing everybody more than if we just treated whatever they had. So part of it's practical too.
Well, you know what? I hadn't thought about that, but you are right. So many of them in prison are in there for a nonviolent
Yeah,
offense.
they're just there for a few months. Maybe they couldn't make bail, whatever.
I see.
And
see.
they die there. We got a problem with
And
this.
they die of
Preventable
issues
stuff,
that they
man.
wouldn't have died had they been out out here in
Sometimes
society.
Sometimes it's stuff they just couldn't make their bail, and they're in jail and died of something preventable.
Now, did you ever notice a difference in medical access, difference between the men prison and the women prisons, or no?
That's a good question. Most of the cases that I've helped with in my advocacy work has been men, but just in general, people that are in facilities have less access to medical care.
Okay. And last question: what is it you can advocate for these women to stay healthy? Will they eat right? Supplements. The bottom line is on the supplements. Do you recommend any herbal supplements at all, or no recommendation? No garlic. No ginger supplements. What's your position on supplements, doctor?
I don't, personally. I think just eat a balanced diet. Do your best. I think a lot of supplements aren't necessarily regulated at all. So just eat colors, foods of different colors. Eat veggies that look like they've got different colors. Do your best. Eat a balanced diet. Stay active.
And what about the water intake? How much water should these women be drinking?
You should drink to thirst. Because your kidneys regulate thirst and things like that, unless you've got a kidney problem. Have water around. Drink when you're thirsty. Don't let yourself get thirsty, okay?
Hey, Doc, I can't thank you enough. Thank you so much for today.
Thank you for having me.